At home is that more Americans are coming home with serious injuries, and that's because medics are better than ever before it's saving their lives. 360 MD Dr. Sanjay Gupta spent time in combat medic training to see how.
A combat medic treats a wounded soldier. Airway secured, shaky hands, an IV inserted. Location coordinates radioed to a medevac chopper.
Bravo.
A lifetime is now measured in seconds.
1, 2, 3.
I want to give you a sense of what's happening now. They've actually moved this patient to an evacuation area. And one of the hallmarks of that evacuation is actually setting up a perimeter. This is a potentially dangerous area. They're continuing to survey the patient, but they really need to get him out of here.
To save the wounded, it's no longer be as fast as possible. Now medics have a precise time frame, 60 minutes, precisely 3,600 seconds. They call it the golden hour.
The objective on the battlefield is to get the soldier from point of injury to definitive surgical care in 1 hour.
The military is investing unprecedented amounts of money in training, new gear, and research, all focused on buying more time. They actually want to extend that golden hour.
Wars always cause improvements in trauma care, and that goes back thousands of years.
Scientists at Massachusetts General are working on suspended animation, actually cooling a casualty's body down and slowing the body processes. At the Wake Forest School of Medicine, amazingly, they are working to regenerate body tissue like skin or fingers. It is for the battlefield, but ultimately, of course, for civilian medicine. Millions of military dollars to add time to treat an injury.
What do you think has been some of the biggest changes in military medicine?
I think the emphasis on training. Training is all important. You can have all the best devices and products in the world, but if you don't train folks at all levels, medics, nurses, and docs, from level 1 through level 5, how to use the products and concepts, then it's all for naught.
And the Army trains its medics more rigorously than ever before. They learn to treat patients under extreme conditions, blindfolded, in little to no light, under simulated gunfire.
Coming under fire, lots of dust blowing around. You see how they hang on to each other. They don't actually put their hands inside the vehicle, and they get those bodies out of there as quickly as possible.
The equipment is efficient. Wound dressings that can actually clot blood. Tourniquets that a medic can apply with one hand. Simple and standard issue with these packs. Each medic is expected to be as good as a doctor or a nurse at treating battlefield wounds. All of that with just 16 weeks of training.
This is an example of the training that we're talking about. There are 13 casualties, supposedly from a convoy bombing, a suicide bomber. There are 8 medics that have come in here trying to stabilize these patients as quickly as possible. It is dark, there's a lot of noise, and sometimes they can't tell exactly what the injuries are. A lot of communication back and forth to try and figure out how to best take care of these patients.
Yes, it's fake blood and simulated situations, but the pressures are urgently realistic.
You walked away from a guy that still had a heartbeat.
If you look at civilian society, to learn as much as they're learning in 16 weeks would typically take how long, do you think?
Something like this probably at least a year. They think they know a lot. They just haven't figured out how to process it all at one time. And they leave here, they feel bad about themselves. That group walking out of here, they're going to go outside and cry.
Though the medic boot camp is intense, it's working. The killed in action rate today is almost half that of the Vietnam War.
It's really pretty amazing when you consider that the wounding agents are exactly the same. The U.S. military has the time and the effort and really the time to focus on these casualties and improve our system.
Dr. Sanjay Gupta, CNN, Brooke Army Medical Center, San Antonio, Texas.